Hello, my name is Joanne Nix and I'm the Chief Nursing Officer here at North Baldwin Infirmary. We're here today to honor the faces of North Baldwin Infirmary. We're going to talk a little bit about COVID and how that affected our staff, our patients, our facility, as well as our community. When we first started hearing about COVID, it seemed like it was something that was happening somewhere else. It was not something that we were going to really be affected by. People ask, is it the same thing as the flu? Or is it worse than the flu? And to be perfectly honest, I really didn't have a good idea about that. But March 14th, 2020 is a day I'll never forget. That is the day that we had the first COVID positive test reported at North Baldwin Infirmary. And that really changed the course of our lives here in Bay Minette, as well as Baldwin County, Alabama, and the rest of the United States. We started realizing that this was going to affect us, and it was going to affect us personally, our community, and then more importantly, really how it affected us here at North Baldwin Infirmary and our staff.
We had the first case of Baldwin County. So I got the call at home on a Saturday with a house full of people eating dinner that we had had a patient that had tested positive for COVID and had been discharged. It was an unbelievable experience to have had the first case. And it's just kind of, it's been a domino effect ever since that's going on our third year now.
Actually, I do remember the first date I had the first patient. It was in April of 2020, and I know the room number. The lady sent me a letter. It was a female patient, and she was my first COVID patient. And to be quite honest, I was scared. I was nervous of the not knowing what was ahead with COVID, because our country was in a pandemic, something that we have never experienced before. And every day the CDC was giving different guidelines for us to go by. There was PPE shortages, and we just didn't really know what to expect.
Oh, I for sure thought it was real. I've seen the news, so I guess, but I've never seen anything like it before. To see the number of folk that we had, especially here at North Baldwin, was amazing. So it was something in 26 years of doing this I'd never seen before.
The pandemic allowed us as a hospital to come together. The staff supported one another. We supported each other's families. We began to understand that everyone was going to be affected by this. We did close departments down, and at that time then we had clinical departments that were accustomed to doing one thing, helping out in other departments.
When things got really bad, they did shut our department down, cardiac rehab down. We didn't want to take any risks there. So I, in turn, was doing COVID testing here at North Baldwin, at ProHealth, at Thomas, and then also trying to assist some over in the hospital just to ease the load on some of the nurses and help them out some when I had the additional time.
Our staff became the caregivers, the support for each other as well as the patients.
Some of the hardest times that I had personally here working with COVID was just the feeling of being tired, exhausted, I'm gonna say physically, mentally, emotionally. I was just beat up. I actually had a doctor come to me one day and ask me if I was okay. And I told him I was okay, but deep down I wasn't okay. I was, you know, all of the above. I was tired. But I had to keep pushing through, and with lots of prayer, I made it through, and like I said, we made it through it.
I had no idea when I took the job 7 years ago what it would entail with the COVID outbreak, but I had some really good support with administration and all of the managers and the staff in the hospital, and we have just as a team come together and survived. It went from basically a Monday to Friday job, 6:30 to 3 to 24 hours a day, 7 days a week for years. I'm on call 24 hours a day, and I would get calls in the middle of the night, from supervisors asking questions to staff asking questions to employees being scared. So my cell phone number was accessed by everybody, which I want them to have free reign to me anytime they can. But it was a lot of sleepless nights that first 8-9 months. There were several of us that are staff, like administrative RNs, and I would work my 6:30 to 3, and then at 3 clock out and work in the emergency room or on the floor from 3 to 9. So I was pulling 18-hour days, about 3 hours a week for about 6 months, just trying to help and support the staff wherever it was needed. There were about 5 of us that did that, picking up weekends and everything. But it was just amazing the amount of people that really came together and tried to help as much as we could. And the scary parts, I think, honestly, the lack of PPE was extremely scary for me as an infection preventionist. But we had very few staff that actually came down with COVID as a result of an exposure here at the hospital. So I'm extremely proud of their adherence to our isolation precautions and our PPE and just all of the aspects of it. They were very compliant with, and in the end, it really helped, because we needed every staff member here that we could get.
I think the response was good. All of a sudden, I mean, we did get more ventilators here, vapotherms, BiPAPs, to help fight this. So we were much better equipped, the next time around, for sure.
I felt like after leaving work at the beginning of the pandemic and going home to my family, I was very scared. I didn't want anyone to be around me or touch me or speak to me or say anything to me, but and the difference now is, like I said, we're learning so much more. If you're using the correct PPE and going through the guidelines like you're supposed to, it's not as contagious, if you're doing everything that you're supposed to do. But yes, it was very scary at first.
I was worried when we first started getting our patients, because, following what was going on elsewhere, and then when it came to our area and started hitting our patients in our hospital, the fear and the worry set in. When everything began, when we would work, I would definitely go straight home and change my clothes in the garage, take my clothes off in the garage, go straight to the shower. Absolutely did not want to bring anything home at all, if at all possible.
There were a lot of changes in the hospital. The auxiliary who had been here every day supporting us was no longer able to come in the hospital. But they did do a drive-by where we were able to go outside, and they waved to us. They were just as excited to see us as we were as excited to see them. The community came together. We had churches and organizations that organized cars to come and meet and support the staff and shine their lights to assure us that they were here and supporting us in what the staff was going through as well as the patients. We had so many people in the community donate food items, provide meals for the staff, and it was those things that help the staff to be able to continue to get up every day and come to work, because they really were not sure what they were going to be facing, and there were many days when they felt like that they weren't making a difference.
And the community support was unbelievable.
It was wonderful, and we couldn't thank our community enough for their support of our nursing staff and our medical staff, our hospital staff, should I say, completely. Everybody was exhausted. We were working long hours, just stressful, long stressful hours at that. And so just the little bit that they could do for us and showing their support and bringing us some snacks and some food, because many times you didn't have time to slow down enough to eat, but just a bite or something small. So the positiveness just helps radiate and help us to feel better when we're having to work in a horrible situation and setting.
All right, it was appreciative. It's good to have the community behind you, you know what I mean? And I did have several folk to tell me, hey, I was thinking about y'all, I mean, for what y'all was going through. We sure appreciate y'all, and some of us we couldn't imagine what all y'all was probably seeing.
We had church organizations that made masks. They would sew masks. They brought food. It was just such an outpouring of love that the staff really needed.
I'm here today in the Lavender Room we have here at North Baldwin. We have 2 of them. And these rooms were established during the COVID pandemic for a time for staff members to come and relax when we have the time of anxiety and stress, and we just need to get away and have a moment from all the hustle and bustle that we were having to deal with the pandemic that was going on at the time. As you can see here, we have a massage chair. We could turn the lights down, play soothing music, have relaxation time just to yourself, just to gather your thoughts and get yourself back together.
I think that they needed a spot to go decompress, even if it was just for 10 minutes. And I really appreciate everybody that contributes to the snacks and the drinks that are supplied in there. I think it means a lot to the staff, because sometimes they just need to leave the floor for 10 minutes to protect themselves from just being burnt out from the workload.
So during this time too, there was something that was very unprecedented. We didn't allow any visitors to come into the hospital. We had to learn how to provide that care, and so that's where our staff came in. They were there holding the patient's hands and taking care of them, and really, you know, providing hope for the hopeless. We were FaceTiming the patient's family so that they could just get a glimpse of what was going on with their loved one in the hospital. We tried to make extra phone calls to assure them that we were here and providing the care in which they deserved. It was a very scary time for not only the staff caring for the patients, because this was something that we had not experienced before, but it was very scary for the family members because they really did not know what was happening with their loved ones. If they were unable to speak to them on the phone, we were having to provide all of that support for them. It was like nothing that we've ever experienced before.
When you seeing that number of folk, you know what I mean, that's basically didn't make it through this. So it was alarming or so, but once, you know what I mean, you kind of read, we kind of got educated, you know, we got the health nurse and kind of found out what was going on, so it did get better. So we did find ways to, the ones that did survive, what we can do to help them.
We delivered notes. They FaceTimed with iPads. Our nurses were fantastic as far as spending as much time with the patients as they possibly could when their family members couldn't be there. I think that in the very beginning, everybody was so scared, and I think we did the right thing at the time by limiting visitors. With the original Delta variant, it was so much more contagious and severe than the Omicron has been. But I think in retrospect, a lot of patients died by themselves without their family. So I think if we had to do it again, we would probably change that perspective.
And then there was hope. We heard about the vaccine that was coming, that was going to provide some protection for our patients, our staff, and our community.
Oh, I was relieved. So I was one of the first ones to receive it for sure. So it, you know, something to help the folk. You was starting to see more it was more older folk that had, you know, preconditions that were having issues.
And then we opened the vaccine clinic, and people came from all over to get a vaccine. We partnered with Coastal Community College, and we had a drive-by clinic where we were provided hundreds of vaccines. It was hope for the future for everyone.
For the vaccination clinics, we were doing about 3 days a week, and in the beginning we would see anywhere from 70 to 150 people in a day. So we did pair with Coastal. We teamed up with them to do some drive-through clinics at their campus here in Bay Minette, and to utilize their nursing students as well to help us with the vaccination administrations. We had 2 drive-through clinics so that we could do the initial shot as well as the follow-up, the second shot. We vaccinated close to 1,000 with that clinic, and the second clinic as well, because that was their follow-up booster. It helped a great deal having the additional nursing students and the Coastal staff there to help us.
And following that, we had the monoclonal infusions that were available to patients that were already positive for COVID.
We're part of the infirmary system, and North Baldwin Infirmary has all those medications available to this community without having to go distant. And we've got the ICUs to manage it. We've got the accessibility to other specialties if we need them to be consulted. So we're available to the community to manage just like if they were in a larger metropolitan city. And we want the community to know this, that we're prepared for this, and we're managing these patients every day, and our outcomes are right on the standard of the outcomes based upon the national averages, or better actually.
So my COVID experience, after 18 days of being at the house, running fever for about 9 consecutive days, got to the point where I had to seek help. I mean, I had no choice. I couldn't breathe. My oxygen was going down, and my wife loaded me up in the vehicle. When we left the house, I live about 2 miles off of 59, and my wife asked me, so where are we gonna go? And I made the comment to her that I want to go to North Baldwin Infirmary. And she kind of questioned me because in times past I've not made that choice. And due to my involvement and the good reputation that North Baldwin Infirmary has got in the community, I figured let's go up there and give it a chance. So for the first time in 38 years, when I left Stapleton, me and my family chose to drive north to North Baldwin Infirmary to get medical help, and it was the best choice that I've made yet in seeking medical help when I needed it. I mean, when I got here to North Baldwin Infirmary, they quickly assessed the situation and got me back to the ER to start medical treatment. Despite me being at my wit's end, knowing that only the good Lord and medical professionals could help, that they were fighting that fight for me and helping me overcome COVID here at North Baldwin Infirmary. You know, it wasn't until I actually had to come to North Baldwin Infirmary and get medical help that I realized what a blessing this hospital and the infirmary is in the North Baldwin community.
But as we were going through that, we really started thinking about that this was really historical, and we were living history. Generations to come were going to be reading about the pandemic and how the care was provided and what was learned during this time. And they'll be reading about it in medical journals, history books.
Well, some of the things we've learned is just having enough PPE, and then different medications the doctors and everything are doing, and different treatments and early preventive measures we're working on.
In my years of doing this, yes, I think it'll most likely be something else. That's why you got to stay prepared. I'm pretty sure it will be. So I guess we'll handle it. I mean, medicine has grown, and even the years I've gone, I mean, God has blessed us to handle it better. You know what I mean? Vaccines, equipment, or so it's much better than when I started several years ago, for sure.
I believe that this was a definite learning experience for us in the medical field, and in a preparation of emergency or sudden onset emergency. We've gotten some of the stuff figured out, outlined, and then we will be able to step in and you know, take charge and do what's necessary to help with, hopefully, we won't ever have one, but to help if we have some other sort of problem like this.
I've always wanted to be a nurse. I don't know if I would do it again after COVID. I've seen a lot of really good nurses leave the field. I hope we never see anything like this again, but it has prepared us. What doesn't kill us makes us stronger.
Thank you for everything that you've done, and we know together we can face anything in the future.